I applied to Loyola for fellowship because I knew about the great variety of patients they saw here. I knew I'd see such a wide variety of pathologies that really you don't get the opportunity to see at other places.
We have a great mentorship program throughout our department, and I haven't met an attending that is not willing to offer a helping hand and offer advice, even outside of the clinical setting.
There's not a day that passes where I don't talk to people, talk to attendings, learn from attendings, where I don't ask the question, man, how do I become the kind of doctor you are today? And then, of course, they're Loyola trained, and I guess I am becoming that kind of doctor.
Loyola Medicine began as an academic medical center in 1969. It evolved over the years into a sophisticated health system comprised of Gottlieb Memorial Hospital, Loyola University Medical Center, McNeil Hospital, and dozens of specialty and primary care locations. The medical center shares a campus with Loyola University Chicago's Stritch School of Medicine and Hines VA Hospital. Loyola employs around 2,000 physicians and more than 800 trainees in our over 75 graduate medical education programs. Our hospitals contain more than 1,100 beds. Because the hospitals are located just outside of the city of Chicago, there's a diverse patient population. As a resident or fellow at Loyola, you'll experience inpatient and outpatient care, primary care, and the privilege of caring for the veterans at the Hines VA Hospital. Loyola treats the most acute patients in the state of Illinois, offering training on complex cases across more than 50 specialties.
There's so many meaningful experiences during a surgical residency, but probably one of the most impactful experiences for me was when I had the opportunity to assist in a surgery with Dr. Gerard Aboud. I do a lot of preparation. I read about the patient, I read about the operation, I review all the necessary tests and the imaging. Everything was going really well and proceeding as normal.
Right now, Dr. Swigert.
Dr. Aboud called for an instrument to be handed to me and not to him.
You ready for this?
I'm ready. I used to play sports, and I really compare surgery to athletics in a lot of ways. And in this particular case, similar to athletics, I had prepared so much. I was really, excited, nervous, but definitely prepared and ready to do the next step. It says a lot about our program and our relationship with our attending physicians that so early in residency training, we're able to have experiences where we're entrusted with the opportunity to take care of patients and to operate.
Last stitch. Great job, Pat.
Thanks. And that's a really meaningful experience.
We are extremely proud of the reputation we've established across multiple disciplines and specialties.
I would describe the leadership team and the attendings at Loyola as inquisitive, kind, empathetic, and honestly, the best kind of role models that a resident would wish to have.
I think that Loyola really feels like a family. It's a major academic center in Chicago, and it competes on all of those levels, but it is just a touch smaller, and so there's just this family feel to it through that. I love Chicago. It's where I want to be. I think it's a perfect blend of a big city in a Midwest feel. I've lived downtown the whole time that I've been here, so through medical school, residency, and now fellowship. The commute really isn't too bad, and I love being able to be down there. But a ton of my friends and co-residents have lived closer to the hospital, and there's a little more of a suburban feel if that's something that you're looking for.
During my training here at Loyola, I've had the opportunity to assist in the recovery for a bilateral lung transplant patient. This patient was young. She had gotten leukemia and received a bone marrow transplant for that. Bone marrow transplant really ravaged her lungs. Recovering from a bilateral lung transplant is extremely difficult, both physically and mentally. Her recovery wasn't smooth, and seeing what we were putting this patient through really made me realize how much we ask of our patients, how much the procedures and the therapies that we deliver can take a toll on our patient's body and on their spirit. When she was finally discharged, I was amazed at how much stronger she had become. I realized that while we do ask a lot of our patients, the results can be worth it. I got the chance to see this patient on an outpatient basis recently, and she's doing great. She's returning to work, returning to spend time with her family, spend time with her friends, living at home. And it's really validating to see all that work that she had put in and that we as her treatment team had put in come to fruition.
Our Center for Simulation Education allows for the mastery of clinical procedures. In the Walgreens Family Virtual Hospital, students, nurses, and physicians can practice complex ethical conversations, end-of-life discussions, and improve communication skills between interdisciplinary teams. The heart of an academic medical center's mission is to foster scientific inquiry to improve patient care and treatment. We believe that research increases our understanding and ability to care for patients. For this reason, we offer rich clinical research opportunities for residents and fellows. Some of these research opportunities can be found in our Center for Translational Research and Education, or CTRE, a collaboration between Loyola University Chicago and Loyola Medicine. The CTRE is a 5-story, 227,000 square foot building which accommodates principal investigators, postdoctoral trainees, physicians, nurses, fellows, and medical and other graduate students. The center also includes laboratory and support space for principal investigators spanning the fields of basic, translational, and clinical biomedical research, public health, health services, nursing, bioinformatics, and epidemiology. State-of-the-art clinical and hands-on opportunities make Loyola Medicine a top training ground for physicians and surgeons.
The best thing about McNeil residency is the friendly environment where I am learning right now. My co-workers, they are amazing. Nurse staff is great, and the attendings, I think they are well prepared and they are teaching us a lot.
I would definitely describe Loyola Medicine as a family feel. We're all here for one purpose, and iron kind of sharpens iron, and we teach each other, we make each other better, and we challenge each other to be the best physicians.
The Jesuit tradition of Loyola is what really attracted me here for medical school, and it's continued to play a huge part of my appeal of staying at Loyola. It's something that the physicians here take very seriously. I think it's something that the educators here take very seriously, treating the whole person. It makes for better care overall, and it makes for better training for residents and medical students.
Loyola Medicine is really teaching me not just how to perform healthcare, but to take care of the whole patient, and to do so with compassion and with advanced techniques.
I'm really glad I chose Loyola for my residency because we feel as a big family, especially my co-residents. I really feel grateful for having each of them.
My experience here at Loyola will make me a better doctor by exposing me to such a wide variety of patients with rare diseases, patients with very advanced diseases, patients that really give you the opportunity to learn in a way that you just don't get that chance at other places. It makes you work, but it makes you learn, and that's what fellowship and training is all about.
Every single time you get the opportunity to bring someone back to life, it's superhuman, it's amazing, it's a miracle, you feel out of this world, and it's kind of like you're doing everything you were trained to do.